Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. Last week, British Columbians were appalled to learn from the media details of a policy decision to deliberately delay the declaration of COVID-19 outbreaks in long-term care homes. Today, 192 families are asking questions about whether more could have been done to prevent their family members from dying of COVID-19. These families deserve answers. Will the Premier tell these 192 families why this policy change was implemented and families were left in the dark?
Minister of Health.
Thank you, Honourable Speaker. First of all, to all of those families and to all of those in long-term care who have lost their lives or been affected by the COVID-19 pandemic. And there's not a single person living in long-term care who hasn't been so affected. You are always in our thoughts. And those people, that group of people, are who inspire our medical health officers every day to do the work that they do. With respect to our medical health officers, they receive, with respect to the determining of whether an outbreak has occurred or not, years of training. And we put in their hands those important judgments. And I think most people would agree they've done an excellent job. In every case where an outbreak occurs, our healthcare workers move towards the outbreak in order to support people living in those circumstances and the staff dealing with it. With respect to the enhanced surveillance protocols that were put in place, these measures were to ensure immediate action took place when even there was a suggestion of an exposure. This did not change the fact that public health leaders and medical health officers would declare an outbreak where appropriate, but it ensured that action was taken immediately. That was the intention of it. That is what occurred. Obviously, we learn every day about the COVID-19 pandemic and what to do better. But I think our public health teams in terms of long-term care have repeatedly made changes to try and keep people as safe as possible while ensuring the highest possible quality of life. And I'm very proud of our medical health teams and all the work that they do.
Leader of the Official Opposition on a supplemental.
Well, to be perfectly clear, this isn't about healthcare workers. It's not about how hard everyone's been trying. It is about a specific policy direction that was given. And so while I appreciate the minister's answer, it's not good enough. It's simply not good enough. Families deserve a full public accounting about what happened. Media reports show that policy direction was given to not make infections public. And in fact, attempts were made to keep them secret from residents, from families, and even fellow workers. And to the minister's comments, on average, it's reported that it took almost 5 days before facilities across health authorities realized the disease had spread beyond the first infected worker, and they belatedly imposed outbreak lockdowns. This is the government that buried a long-term care report during an unnecessary pandemic election. And now this. This is a pattern of behavior. It's about delay, distract, and ultimately deny. So today, there is no denying that there are many heartbroken families. They have questions, they are legitimate, and they deserve an answer. So will the Premier get up today, and will he explain exactly what his government knew, when they knew it, and why on earth it was kept, and families were kept in the dark?
Minister of Health.
Honourable Speaker, I have family in long-term care. I can tell you that families are not kept in the dark. These moments when outbreaks occur are some of the worst moments. They are for medical health officers, they are for those working in care homes, and most importantly, they are for residents and for their families. They are very challenging moments, and measures are taken immediately, and those measures have increased and improved since the beginning of the pandemic. No, Honourable Speaker, when I became Minister of Health, 87% of care homes were below standard in terms of staffing, and we've taken action to change that. When I became Minister of Health, employees in care homes were treated worse than almost all other employees in BC. We took action together, unanimously, and changed that. We brought in a single site order. We put in some of the best infection control in the country, and the losses still, in spite of all of the efforts of medical health officers, all the efforts of our healthcare teams, have been so deep. There's not a day that goes by that anyone involved, from family members to staff to residents, doesn't mourn those losses. We do every single day. And that's why such significant efforts were made. And yes, changes were made in the measures that were taken during the pandemic. For example, on June 30th, we restored social visits. In the beginning of March, we restored much more significantly visits to long-term care. We made changes along the way in terms of infection control as we learned more about the pandemic. That's what our trained medical health officers do. They make decisions on outbreaks based on the evidence, and they fight every single day to ensure that residents are protected. I'm proud of them. And at the same time, I recognize the profound loss that so many people feel in BC.
Kelowna Mission.
Thank you, Mr. Speaker. With all due respect to the Minister, measures were not taken immediately. Outbreaks were hidden. 192. That's how many seniors passed away from COVID-19 under this government's policy to deliberately delay the declaration of an outbreak in long-term care homes. More than 1,000. That's how many people were infected. And the government's approach was to cover it up. The only reason we know about this today is because the government was forced to turn over documents through FOI. Will the Premier please explain why the government concealed the policies that cost lives in long-term care homes?
Minister of Health.
Honourable Speaker, I think with, as the member says, all due respect, the suggestion that the efforts, the immediate efforts of our medical health teams, of our provincial health officer, of our public health system in responding to these situations, to COVID-19 in long-term care and to outbreaks in long-term care, caused this loss of life is not supported by the evidence. And I think it's important for us, of course, to have these discussions seriously. Of course, it's important that we be held accountable. But it's also important that people not make statements and accusations about people who move towards the crisis when it occurs, not away from it, but towards it, who make very challenging decisions to protect and respect people living in long-term care in their homes, and as well to ensure that to a maximum degree infection control is put in place, that we deal with this debate in a respectful and a thoughtful way. From the beginning of the pandemic, that's precisely what our medical health officers have done across BC. And I think with great respect, as the member says, more respect is due to them for those considerable efforts.
Member for Kelowna Mission on a supplemental.
Thank you, Mr. Speaker. This isn't about the public health officers. I am actually talking about the actions of this health minister. The health minister who now says that he will, quote, look into this important matter, end quote. Well, I believe he should have been looking into it when this policy was developed last October. But instead, he was campaigning because of the Premier's pandemic election. Some facilities waited up to 2 weeks between the first staff case and declaring an outbreak. And in the worst case at Little Mountain Care Home, 41 seniors lost their lives. Will the Premier tell these families why the government concealed the risk these seniors were facing?
Minister of Health.
Honourable Speaker, with the greatest of respect, I could not disagree more with the members' really extraordinary criticism and attack on our public health teams and our public health professionals. The actions that have been taken with respect to protecting people in long-term care, actions that have meant that our record, when compared virtually to anywhere else in Canada and across North America, and indeed where long-term care systems exist, have led to lower mortality rates than anywhere else. Those actions, I think, are worthy of respect. To conflate issues in this way, when the stakes are so high, when so many people lost their lives, when the impact was so great on everyone involved, but especially residents and their families, I think is the wrong approach. I take a pretty serious approach, and not a day goes by, not an hour goes by, when Dr. Bonnie Henry, when our teams in the health authorities, myself as Minister of Health, and I know members of this House and members of the opposition as well, don't think about long-term care and what more we can do in long-term care. And that's why such extraordinary measures were taken before the pandemic and why such extraordinary measures have been taken during the pandemic here in British Columbia. It is a tragic situation indeed when anyone passes away from COVID-19. But I think our teams have done and the balance of events shows this, in difficult circumstances, when the declaration of outbreaks have profound effects on people as well and their health. They've done a very, very good job.
Leader of the third party.
Thank you, Honourable Speaker, and I'm listening very closely to the questions and the responses, because I think this is something that British Columbians are very concerned with. And the report that came out by Ian Young for the South China Morning Post found that from November to February, 192 British Columbians died in long-term care homes in Vancouver Coastal and Fraser Health under a change in policy where authorities did not declare outbreaks when an employee first tested positive for COVID-19. These are important questions to be asking, and I think that they merit a response from the Minister that acknowledges that British Columbians, citizens, do have a right to know and understand these decisions, and that government is recognizing the seriousness of the implications of these decisions. As has been identified by the official opposition, the investigation found that it took on average 4.7 days between when an employee tested positive and when care homes found that the case had spread beyond the first individual and into the wider community. And it's challenging, Honourable Speaker, to hear the term enhanced surveillance being used to describe less communication and less monitoring and testing during a pandemic. So my question, Honourable Speaker, is through you to the Minister of Health. What was the goal of this strategy, and was that goal met?
Minister of Health.
Thank you very much, Honourable Speaker, and I absolutely agree with the member that a serious debate is required. With respect to outbreaks in long-term care, from the beginning of the pandemic, our medical health officers took a rigorous and disciplined approach throughout the pandemic. And that was reflected in the declaration of outbreaks frequently, where there was only one case and only ever one case. With respect to those healthcare facilities that were subject to the enhanced protocols or the enhanced surveillance, they had different names in the two health authorities. Many of those cases, in fact, 80% of those where such a technique was applied, resulted in no outbreaks, and others resulted in outbreaks. And this is what occurred. But when the member says that no action was taken, in fact, very significant action was taken immediately, and then more action was taken as they went forward. These were the judgments made by the people that we put in these positions, medical health officers with 5 years of training and deep experience who make very difficult decisions about outbreaks, decisions that have implications in every sense, implications for the people who live in long-term care and for whom it's their home on the one hand, and the need to keep people protected. And I think our approach in British Columbia has been the right approach. That means from time to time that medical health officers make changes in their approach to it, for example, with respect to recommendations about visitors in BC. And these are the decisions we would expect them to make in order to help keep people safe, but also to recognize the profound impact of the pandemic on everyone in long-term care in every way, even those ways beyond COVID-19.
Leader of the third party on a supplemental.
Thank you, Honourable Speaker. And I think that it's important to note that there were 42 outbreaks during this period in long-term care homes, 1,000 cases, and as has been pointed out, over 190 deaths. Before November 9th, 2020, Fraser Health was directing its long-term care homes to treat one positive COVID-19 case as an outbreak and to impose tight restrictions on its staff and residents. After November 9th, the directive was relaxed. In the week before this decision, BC's 7-day average for cases was growing exponentially. The government made a choice to relax outbreak standards in long-term care homes in the middle of the growing second wave of COVID-19. That choice was questioned at the time by both BC's seniors advocate, Isabel Mackenzie, and Terry Lake, the chief executive of the BC Care Providers Association. Both advocated at the time for more testing and brought their concerns about the repercussions of this policy change to the Minister of Health. My question through you, Honourable Speaker, is to the Minister of Health. Why were the rules relaxed for long-term care homes in a growing second wave? Who made the choice, and was it approved by the Minister?
Minister of Health.
The decisions around whether an outbreak is declared are statutorily the responsibility of medical health officers under the direction of the provincial health officer. And I support the provincial health officer. And I support medical health officers, and I will continue to do so. With respect to Isabel Mackenzie, during this period, she was not wrong or right to do that, strongly advocating for more visitation in long-term care and, in effect, a relaxation of some of the measures that were in place in order to deal with the social consequences of COVID-19. The idea that Isabel Mackenzie, and I don't think this has been suggested, I don't think by either Ms. Mackenzie or by Terry Lake, that they came to me and talked to me about this in particular, is just not correct. I don't believe, I don't have any recollection of it, and I don't think it's true. I think they were arguing for different things, and that's a different discussion. We shouldn't conflate these issues. These issues are very serious, and the provincial health officer consistently has taken a strong position in BC with respect to the declaration of outbreaks in long-term care, and will continue to do so.
Member for West Vancouver, Capilano.
Thank you, Mr. Speaker. Mr. Speaker, last week, without warning, the government cut the Climate Action Revenue Incentive Program, gutting support for local action to fight climate change. UBCM President Brian Frenkel says not only are communities puzzled, but there was absolutely no consultation at all before this decision. Mr. Speaker, to the Premier, can he explain why he didn't even bother to consult before cutting local climate action?
Minister of Municipal Affairs.
Thank you very much, Honourable Speaker, and thank you to the member opposite for the question and enabling us to have a discussion in this House about the very critical and important role that local governments play in climate action. Mr. Speaker, we all should be very proud of what local governments are doing to tackle climate change, and we know that communities are on the front lines of climate change. Mr. Speaker, CAREP was introduced over a decade ago to encourage and incentivize local governments to sign on to BC's Climate Action Charter and to begin reducing their greenhouse gas emissions. And Mr. Speaker, over the last 10 years, CAREP has done that heavy lifting, and now we have 187 of BC's communities out of 190 local governments that have signed on to the Climate Action Charter. As a former mayor and a longtime advocate for climate change and climate action, I can tell you that much has changed in that past decade. And so now, Mr. Speaker, we want to build on our record investments into Clean BC and in climate action and work with local governments to support other pillars of the Climate Action Charter. Mr. Speaker, we know that local governments want to take action on creating more compact, efficient communities. And so, Mr. Speaker, in Budget 2021, we have set aside $11 million to do that work and to work with local governments. I'm really looking forward to working with local governments on that and hope to have much more to say soon. Thank you.
Member for West Vancouver Capilano, supplemental.
Thank you, Mr. Speaker. The timing of this is unusual as emissions have gone up every year under the NDP government. This is Local Government Awareness Week. The minister tweeted about it and hypocritically claimed she is proud to work with BC's local governments, but then ignores them and cuts important funding that they need. This defines hypocrisy. She should listen to the Climate Caucus and the UBCM Committee on Climate Action, who are saying that funding that she cut was foundational to their efforts. 7 months ago, she was part of the leadership of that committee. The District of Saanich has written to the Minister and the Premier to say that this was, quote, extremely unexpected, and it is clear that local governments have not been engaged, end quote. So why is this Premier betraying local governments on climate action?
Member, be careful about the language we use in the question asking. Minister of Municipal Affairs.
Thank you, Honourable Speaker. Yes, I'm absolutely proud of the work that I've done as a former local government leader and on a number of different climate solutions panels or committees. And the work that local governments are doing to this effect is absolutely extraordinary. So, Mr. Speaker, this is about listening to and working with local governments, communities of all sizes across BC. But, Mr. Speaker, there is one more year of CAREP funding coming. So this decision gives us the months to come to renew and to transition our relationship and support for local governments as we all work together to tackle climate change. Mr. Speaker, we should be very proud of what local governments do. I'm certainly very proud to be the Minister of Municipal Affairs and to work with a government that listens to communities and is working with them to tackle climate change. Thank you.
Member for Kamloops South Thompson.
Thank you, Mr. Speaker. Well, I would suggest to the Minister that listening to and working with local governments is not about slashing programs which local governments have been embracing for over 10 years without any consultation. And before the minister crows too much about the NDP's record on climate, she might want to be advised that emissions have gone up every single year under the NDP. Their plan has a 44% gap in actually achieving their 2030 emissions reduction target, and they ended revenue neutrality on the carbon tax. Not a record that they should be too proud of. Mr. Speaker, here we go again. Last week it was the fruit and vegetable program. This week, again without consultation, this government is cutting a successful program that's doing good environmental work at the local level. Communities across BC have embraced this program, and they've counted on it for its steady annual funding to fight climate change. Even in the letter the minister wrote to municipalities about her decision to cut the program, she boasted about its success, saying, and I quote, 50 local governments reported achieving carbon neutrality, end quote. As New Westminster Councillor Patrick Johnstone says, and I quote, it's the only data source we have for how cities are doing on their greenhouse reduction. You can't manage what you don't count, end quote. So again, Mr. Speaker, last week it was fruit and vegetables. This week, why is the Premier betraying local communities by eliminating this very successful and very important local climate action program?
Minister of Municipal Affairs.
Thank you, Honourable Speaker. And again, the CAREP program is winding down this year, and we have the coming year to talk to local governments about other ways and additional ways to support them in the Climate Action Charter, including the creation of compact complete communities, a pillar of the Climate Action Charter that, Mr. Speaker, we have set aside $11 million in funding in this year's budget to develop and deliver and work with and support local governments. But, Mr. Speaker, CARIP is not the only way that we've been funding local governments and supporting them in their work. And, Mr. Speaker, over the last decade, much has changed. It is time to renew, to transition, to work with local governments in ways that suit today, not just a decade ago. So, Mr. Speaker, over the last decade, we have created the BC Climate Action Toolkit. We have invested just recently over $63 million in partnership with the federal government through the Clean BC Communities program to support local governments in their efforts to create more energy efficient and switch to clean energy. Mr. Speaker, we've boosted active transportation infrastructure with an $18 million investment, and the list goes on. Mr. Speaker, we know how important it is to work with our partners, local governments. I'm absolutely committed to doing that, and that's what we're going to continue to do. Thank you.
Ma'am.
Thank you very much, Mr. Speaker. Well, 7 months ago, as the mayor
Member for
of
Kamloops South Thompson, on supplemental.
Thank you, Mr. Speaker. 7 months ago, as the mayor of Tofino, her community benefited from this local climate action program. But the first thing she does as minister is she goes and cuts it. She was a mayor, and she was part of the leadership of the UBCM Committee on Climate Action. She knows how important this program is, but she's cutting it. Now, Doug Smith is the Director of Sustainability at the City of Vancouver, and his team has lost half its operating budget because the minister has cut this successful and critical program. As Doug Smith points out, and I quote, "This was a surprise for the City of Vancouver. The difference with this money, it's not something you apply for and you hope you get. When you're talking climate change, that's not viable," end quote. So the question again to the Premier is, will the Premier admit that he has misfired yet again, and will he direct his Minister of Municipal Affairs to not proceed with cancelling this important and successful local climate action program today?
Minister of Municipal Affairs.
Thank you once again, Honourable Speaker. And let me reiterate just how important local governments are in tackling climate change and the battle that we have before us as all orders of government. Mr. Speaker, so much has changed over the past decade. I've heard from a number of different local governments over the past week and a real range of responses. Mr. Speaker, we know we need to listen to local governments, and we know we need to know how to support them in the actions that they want to take. So, Mr. Speaker, sometimes that does mean renewal and transition and change. Mr. Speaker, I'm so committed to sitting down and having those conversations with local governments. I think the member opposite knows that. He knows where I'm coming from, and he knows just how passionate and committed I am to this file. So, Mr. Speaker, that's exactly what I'm going to do with my colleagues in this government. So proud during this week, Local Government Awareness Week, to continue and renew that commitment to working with local governments. Thank you.
Member for Abbotsford South.
Thank you very much, Mr. Speaker. You know, the Legion is dedicated to service. Members who have served by protecting our country, but also by providing service to our communities. The Legion is looking for assistance through the Circuit Breaker program, but the province has said no. And I have learned that they are not the only veterans that do not qualify. The Army, Navy, and Air Force organization also does not qualify. They wrote to the Premier, quote, "We find that the Legions of BC are being discriminated against by our exclusion from the same grants that are available to our industry association colleagues in BC's beleaguered hospitality industry," end quote. The first time we asked the government to fix it, all we got was a condescending response that the Premier really likes the Legions. Well, that doesn't pay the bills, Mr. Speaker. Question to the Premier. Will he do the right thing and fix his bungling so Legions and Anafets can qualify for the assistance they need to survive?
Mr. Premier.
Thank you, Honourable Speaker, and I do like Legions, so that was a fair comment. I joined the Legion in 1979, and I defy anyone in here to match that except perhaps a member for Abbotsford West. But the member puts the question forward in good faith, and I appreciate that. And I also understand the challenges that the Legion is facing as a result of COVID-19. It's dropped off all of the activities, whether it's renting halls for weddings, for dances, for the regular gatherings, whether it be Battle of the Atlantic. Remembrance Days were not, the last Remembrance Day was not like any other we've ever had. So I appreciate the intent with which the members asked the question, and I've been working with ministers on this side of the House and the federal government to try and find ways for not-for-profits to benefit from the myriad of programs that we have in place. Now, I appreciate that you're going to ask me a supplemental question, so I'm going to sit down so you can do that. But our commitment on this side of the House, Honourable Speaker, is to make sure that we are working with everyone in the community, not-for-profits, businesses, communities, individuals, so that we can get through this pandemic together. And we're very, very, very close to seeing the end of it. I hope it happens soon before the next question.
Member for Abbotsford South, supplemental question.
Thank you very much, Mr. Speaker, and thank you to the Premier for actually standing up and answering a question today. I appreciate it. But there seems to be that maybe the Premier has not bothered to read the letter. So here's another quote. The Legions of BC are facing the same threat of closure, laying off of staff, inability to pay for utilities, and to pay for property taxes, end quote. These veterans who have sacrificed so much aren't asking for anything extra, Mr. Speaker. They just want to be treated the same as everyone else. There are 141 Legions and 18 Anavets in BC that are asking for the Premier's respect and help. So again, to the Premier, will you do the right thing and show these veterans the respect they deserve and allow them to apply to the Circuit Breaker program? Thank you, Mr. Speaker.
Premier.
Thank you, Honourable Speaker, and I appreciate the intent of the question. We have been working with the not-for-profit sector from the beginning of the pandemic. The Economic Recovery Task Force included representatives from the not-for-profit sector because of the profound impact mostly volunteers have had as a result of COVID-19, mostly aged volunteers, and particularly when it comes to Legions right across British Columbia. So protecting those individuals is a very high priority. Making sure that they will be sustained throughout and beyond the pandemic is why the e-commerce program was put in place. The emergency rent subsidy was put in place. They can access that. The emergency wage subsidy, they can access that. But with respect to the circuit breaker and the impact on food and beverage, which I think is the intent of the question. And I know that's a core business for the Legion to make sure that they get the dollars in the door so they can pay for all the important programs they put in place to make sure our veterans live in the dignity and the respect that they deserve. I will take the question to my colleagues and bring it back to this House at an early opportunity. But what I don't like, Honourable Speaker, and what I'm confident that the member, as a new member, did not intend, to denigrate anyone's respect for those who have put their lives on the line to protect liberty so that we can sit in this House is a little bit off the line, and if he doesn't mind, I'd ask him to withdraw that comment.
The bell ends the question period.